Well, welcome back. It's important that we keep all of our essential workers in mind, especially our healthcare workers who are on the front lines of this coronavirus pandemic.
And here to discuss burnout and what clinicians can do to get through this tough period, Dr. Stanton Smullens, chair of the Patient Safety Authority. So first off, good morning, Dr. Smullens. Thank you so much for joining us.
My pleasure. Thank you.
So let's get right to the burnout issue. Obviously, it's not a new problem with medical workers, but how has this pandemic and COVID-19 specifically kind of amplified the issue and brought it back into the forefront?
Well, one of the concerns is that pre-pandemic, up to 50% of physicians and a high percentage of nurses were reporting burnout. Also, pre-pandemic, the suicide rate among physicians and almost as high in nurses is 2.5 times that of the normal population. So these very, very startling statistics might be made worse by the pandemic.
Wow, those numbers are pretty wild.
They are.
So talk to us a little bit about some of the symptoms of burnout for those frontline workers. Like, what should we be aware of?
Well, the classic definition of burnout is someone who is emotionally and physically exhausted. Also, they have a sense of isolation. They feel depersonalized. They don't feel close to anyone, certainly not close to their patients. And this is a very, very difficult feeling. And also, there is a total sense of failure. You feel as though all of your work, your whole career has been a failure, and you really wonder why you're even doing in this field.
Right, a sense of being overwhelmed, for sure. Yeah, and you have some tips to offer some of these workers during this time. So we're going to go through them now. We've got tip 1 on our screen. It's do not bury your feelings and soldier on. Speak up. If you need help, you're supposed to ask for it. Explain.
Yeah, people in the healthcare field feel as though they're super people, that they can work, bury their feelings, and just work indefinitely without having any rest or any kind of time for themselves. And this just is not so. If you don't understand your feelings, if you don't share them, if you don't talk about them with others, they're only going to build up and cause you to really become immobile in terms of your activities. So you have to either talk to friends about them, you have to journal about them, you have to acknowledge them, or else the burnout will get worse. If you really get the sense of totally being overwhelmed, totally helpless, then you have to reach out to a mental health professional. And these can be done through telehealth, through video conferencing. They're available, and you have to acknowledge how you feel. Otherwise, the symptoms of burnout will get worse.
Let's move on to tip number 2. We're going to put that up here on the screen. That's remember that social distancing does not mean isolation. Technology is a gift. Use it.
Absolutely. Technology is a gift. You can reach out to your spouse, to other loved ones, to parents, grandparents, friends. Let them know how you are. Reaching out, having these human connections will really make you feel a lot better and give you a sense of a way of expressing your feelings, which is so critical, so critical.
And let's move on to tip 3 now for the folks that are dealing with this firsthand. Enjoy the meaningful pursuits, even for a few minutes. So it's the little things, right, Dr. Smullens, is kind of just as you're going through this, kind of reflecting on what's important.
Absolutely, because even though you may be working 12-hour shifts and probably even longer than that, you have to take some time for yourself. You have to eat, you have to listen to some music, do a few exercises, something for you, get something to read, whatever it takes to get your mind off of what you're doing. Because unless you refresh, unless you take care of yourself, you can't take care of anybody else. So it's very, very important.
And the final tip, let's put that up on the screen. Tip number 4, plan future activities for when the pandemic is behind us. Dream now about what you will change when this is over.
Yeah, this fortunately will go away at some point. So you realize through this that life is fragile, and you have to plan. Are there things that you've wanted to do? Is a trip you wanted to take? Have you wanted to learn how to paint? Is there something different in your career you would like to do? Now's the time to plan, because if you have something really worthwhile that you enjoy looking forward to, it will help you get through this very, very difficult time.
Right, and also for all of us that maybe not in the industry or in the field, we can always lend some support too, and just some small words of encouragement to help those folks on those front lines too.
Absolutely, no question about it.
All right, Dr. Smullens, thank you so much. Very important information there as we go through this this difficult time.
Thank you for joining us.
Thank you for having me. I appreciate it.